Okay, we are going to talk about vitrification, embryo vitrification, blastocyst vitrification, and warming. This process is always very important for the patients because we vitrify an important proportion of our embryos. And when we vitrify the embryos, we eliminate the water, or we substitute the water by a cryoprotectant, and then when we warm the embryo, we take out the cryoprotectant and we put the water. Let's say that process is the process in which the embryo recovers life. And that process takes between 3-4 hours normally, is the time that we leave the embryos in the incubator since we warm until we transfer to the mother. In this study in particular, what we have done is record this process of 4 hours using time-lapse incubators. During these 4 hours, the embryo starts to re-expand. Initially it's collapsed, it's trying to re-expand, sometimes collapse during the process, and it's starting with a small piece of embryo, and then it's growing and becoming bigger, and then we can measure the final size of the blastocyst, the final diameter, the thickness, etc. All these measurements that we normally used to do with the time-lapse tools, the drawing tools of the time-lapse, now we are studying this process by artificial intelligence. We are putting those videos into the machines, we are giving the information about the outcome of the embryo, and we are trying, actually we have discovered that there are some patterns of this process of warming, these 4 hours of growing of the embryo, which are related with higher outcome or better chance to have a baby, and some patterns that are related with very low outcome. The difference with the work that we did in the past, in which we did, first of all, we never record that process, and secondly, we never use artificial intelligence tools that are able to warn us that that embryo is not going to have an ongoing pregnancy, or it's going to be quite difficult to have a baby, and in some cases just the opposite. So it's a perfect tool to help the doctors, help the embryologists to distinguish embryos with very low implantation potential after warming, and that has nothing to do with the quality of the embryo. We can have a wonderful embryo, very nice, good quality blastocyst that we freeze, but then after warming the behavior can be affected, and then the outcome could be really affected too. So this is why this technology is really helpful in the process of embryo selection.